Constitutionalists. I want to talk to you today since the health care, Obamacare, and the replacement health care bill, the Ryancare I call it, because everybody's calling it Trump care. Trump has not signed anything yet, so it's still in the ball field of the Speaker of the House, Paul Ryan. And I was listening, I saw a couple things on Facebook, and I was listening to some radio shows on my Roku box. I have an app set up. I can listen to some radio shows on there. And liberals have been touting that 65% of Americans are on Medicare or Medicaid, one of the two, okay? And I thought, man, that is awfully, awfully high. You know, working Americans, 65% are on Medicaid. And I'm like, something's funky here. So I go to my one source that I go to, the Kaiser Family Foundation. They do a lot of research in medical insurance, health issues, things like that, and they actually get numbers. They don't take polls or anything. They actually go find out the raw numbers and put that out. And I have this here. I'll put a link in the show notes page down at the bottom of the video today. But I have this today, and basically it has all the states if you go to the link, and it has each state individually. And I just want to take real quick to talk about the United States. Employer-based insurance, the insurance you get through your employer while you're working, is 49%. Non-group is 7%. That means individual plans. Medicaid makes up 20% of the population, and Medicare makes up 14% of the population. And the other, there's another public that's public insurance is 2%, and I'm not sure exactly what that is. And we still have 9% that are uninsured. For whatever reason, they just refuse to get insurance, and that's fine. That's their choice. And I was looking at this, and if the numbers were higher in Medicaid, even if you're employed and through an employer, that percentage should be higher than 20%. It's not. And so Medicaid and Medicare only make up 24% of those that are insured. 56% of folks are insured or either employed or non-group, the vast majority. So liberals, again, are hoping, and folks, this is a standard operating procedure for liberals. They're hoping that their low information followers will just take their word when they spout things like, well, 65% of working Americans are on Medicaid or Medicare, either one. When the numbers just don't hold up. And Kaiser Family Foundation is a very credible, very well-researched group of people, and I trust what they have to say. So whenever you hear these statistics, folks, please, I know if you're listening to this video, you're either got a smartphone or you have a computer and you have access to the internet and you can go do some research. You can look these things up. When something, walks like a duck and talks like a duck, looks like a duck, and even smells like a duck, chances are it's a duck. So when something doesn't sound right or look right or smell right, it probably isn't right. And they're just pulling numbers out of the air to scare you into believing that if we get rid of Obamacare, that a lot of people are going to be hurt by this, and they're really not. People are being hurt by this now. Working families that have their health insurance, even employers have health insurance or buying health insurance through the exchanges because to them it was cheaper, but to the individual it's more costly. My premiums, real quick here before I end the video here, my premiums for a plan I couldn't use were over $400 a month for a family plan. It was closer to $500. I had a $4,000 individual deductible. It was a $9,000 family deductible. And I don't know about you, but I'm not rich, and I can't afford to put out $9,000 of deductibles before the insurance starts picking anything up for my family, including my prescription drugs. So I would like somebody to tell me how Obamacare made my insurance better. It didn't, and it didn't for a lot of working Americans. Did not make it better. It made it worse. So folks, when you hear these phony stats that they do not back up, and this is the big thing, they will not back them up. They will not give you links. I ask people for their sources. When they spout stuff, I ask them for their sources, and if they come back to me and say, well, you need to go look it up yourself, I say, take it down, especially on Facebook. Take it down. If you cannot source it, you need to take it down. They don't, and then they get after me about it, but Oh, well, I don't have time to look up the sources for you. Well, then don't. If you don't have time to look up the sources, you don't have time to post stuff. I'm just saying, folks. These are my thoughts for March 23rd, in the year of our Lord 2017. Have a great rest of the day, and God bless.